right, guys, today we're talking wrist pain. Do you ever experience wrist pain when you're doing curls, bicep curls like this? I do, I have. In fact, my wrist is bothering me a bit right now, and there's a reason that I'm using this bar, and we're going to talk about that. So the topic today is ECU tendonitis. What is that? Extensor Carpi Ulnaris. That's this muscle right here. The point of this muscle is to extend your wrist in this way. So it's a long muscle and it has a long tendon that crosses the wrist. And right here, that tendon is vulnerable to injury because the tendon crosses the ulna bone. And so it's a point of friction. Anytime you have a tendon that's pulling across a bone, you can get friction in that area after repetitive movement. So that tendon sits in a groove in that bone, and anytime that you supinate your wrist and you ulnar deviate the wrist and flex it, it's more vulnerable to injury. And so activities that are repetitive, like tennis with all the backhanding and golf, or curling, doing bicep exercises, those can all cause excess stress on that tendon. And that was the case with me. I used to do a lot of straight bar bicep curls, and that caused a lot of ulnar-sided wrist pain. So what I did was switch over to use of a bar like this. This is called an easy bar or a cambered bar. We have a clinic gym, so we had easy access to equipment that we just brought right in the clinic. So this is kind of cool. But this allows you to position your wrist in a more comfortable and safe position like this instead of being maximally supinated, which is sort of it's a position that doesn't work well for most people just because we don't have enough wrist flexibility. So a couple years ago, when I really began to get a lot of ulnar-sided wrist pain, of course, in the course of my medical training, I was, wanted to self-diagnose, and I was doing ultrasounds, and I first recognized the problem with the tendon on the ultrasound machine. And I said, hey, let's get an MRI and see more of the tendon, see what it looks like. And I have a picture of that. So I captured this picture and placed it in an article. It's on our website about how to treat tendons. But this is my MRI. So you can see that there are black circular tendons throughout the wrist. And over here is the ECU tendon, which sits in this groove of the ulna. And you can see it's kind of like which of these is not like the others. This one is frayed. It's got white throughout it. It's almost like it's pulling apart like a frayed rope. So that's pretty common to see. This is in fact a common condition. I can remember reading a paper about tennis players, and they found that more than half of tennis players have an abnormal tendon in the ECU tendon because of all the backhands that they do. So let's go over to the drawing board, and I'll show you, this is the exact thing that we were looking at on the MRI image. So this is the ulna bone. This is a little groove that the tendon sits in, the ECU tendon. And over that is a little piece of connective tissue, this little subsheath, this red line. And you can have a couple different scenarios. You can have someone that has an ECU tendon in that groove that's just bigger than it should be. It's a little bit frayed because they have this tendonitis or tendinosis. But the subsheath is still intact here, the little connective tissue. Or what can happen is that little piece of connective tissue can stretch out, and you can kind of get this extra little pouch in it so that when you turn your wrist, the tendon goes from here to here, and its sublux is outside of that groove. And so you get this excess friction as it goes across the bone, and that causes some problems. Or sometimes that piece of connective tissue can tear, and then the tendon can actually come outside of that groove and the corresponding connective tissue. So those are all different things that can happen. And what do we do? Well, regardless of which scenario it is, we tend to start treatment the same way, in that, first of all, you want to decrease the things that are causing pain. And I always joke that my mother, this would be whatever she would tell you when you come to her as a child and say, Mom, it hurts when I do this. She'd say, well, don't do that. That was her fix. But that's right. So you don't want to do the things that are making the symptoms worse. And in my case, it was the very supinated exercises. Beyond that, you can rest the tendon by bracing it. And one thing that I found to be useful and recommend to a lot of my patients is use of something called a wrist widget. And I just typed this into Google Images. And this brace has, it keeps the tendon in the groove. It helps to anchor it in the groove and take some pressure off of that area where there's a lot of friction on the tendon. So these are pretty cheap, easy to use. Beyond that, we can very safely do ultrasound guided injections into that tendon sheath. In one of our other videos, we talked about how the tendons on the back of the wrist reside within sheaths. And so does this one. So we can do a little injection inside of that sheath to bathe the tendon in either anti-inflammatory medication or things like platelet-rich plasma, which can be helpful. And then for cases that are really refractory, where the symptoms persist for a long time, there are surgical options for this, but we rarely have to explore that with our patients. They tend to do pretty well with conservative treatments. So that's what we're talking today: ECU, Extensor Carpi Ulnaris tendinosis or tendinopathy. If you have any questions, let us know. info@inertiamedical.com.